Here today, and I know this is the first year with the APN Summit in Illinois. Can you tell us a little bit about how the idea got started?
When I started my role at MCHC about 2 years ago, I went out and visited, we have about 94 members, and I visited about 45 executive teams who actually represented almost every member, and asked them really from a clinical perspective what they'd like us to focus on. Or one of the things that we do so well at MCHC is bring people together, collaborate, share, learn, all of those types of things. And so I probably had about 15 chief nurses who said to me, we are really just learning how to privilege, credential, and assess competency of advanced practice nurses. And I would very much like you to bring the group together to talk about how do you do it, what are you learning, what are things that you've learned that you do differently now. So it was interesting, and this is a true story. I sent an email out to 25 chief nurses, and within 15 minutes I had at least 10 responses. So I knew we'd hit a hot topic.
Fantastic.
Usually it's like, a couple weeks later you're asking, could you respond? And then as we went through the first probably forum, we hold our forums probably about once a quarter, and then we did a lot of work in between. It really became apparent or evident to us that we wanted to take the focus beyond advanced practice nurses, but to include physician's assistants, because medical staffs are looking at APNs and PAs, medical staff offices are, and many of the councils that were discussed, kind of advanced practice, mid-level provider, allied health councils, really do become the first voice for advanced practice nurses and PAs. So we just, about June, so a couple months ago, we just made the decision to grow from advanced practice nurses to physician's assistants.
Oh, great, great. And is there a take-home message for attendees at the conference today?
I think there's a lot of take-home where they can, we are sharing survey results, we're sharing, Kathy Grossi did an overview of the law. We're going to share lots of potential processes, forms, structure. So we really, I spent 20 years as a hospital executive, and I always liked a program I went to where I learned something, but also I could in-hand bring something back and customize it to my organization. I think the other is many of us feel like this is just the beginning. With healthcare reform, and there's a physician shortage looming. There are many, many more people who will have access to health care. The need for advanced practice practitioners in the form of APNs and PAs will continue to grow. So I think people are finding it valuable, and you've said, and people are very open and honest in their questions. There's no, I haven't seen any positioning. I've seen much more of openness in querying each other and asking what they're doing, that type of thing. And so I see this as a learning collaborative that MCHC will keep moving forward as the facilitator.
Fantastic. And then what do you think is the biggest issue facing APNs in Illinois today?
Well, I think, as you can see by the questions that have come up today, there's laws and there's regulations, and then there's a whole, the next level is then how those are interpreted and what's the culture of your organization. So really how APNs and PAs are utilized throughout in different organizations really depends on the organization's culture, their experience with advanced practice nurses, the comfort level of the medical staff, the comfort level of the legal and risk staff. All of those things come together, so it's really one size doesn't fit all. So I don't think it's a problem, I think it's a learning, I think it's a continuum. I think the other thing that you'll hear this afternoon is that because patients are admitted to a physician's name, it's very difficult at this point to pull from an electronic medical record or to pull out of a patient's record outcomes attributed to an APN. So to know, is their practice, are they responsible for the patient outcomes? We know that they are very, very involved in the care of that patient, overseeing the care of that patient, but what we're not able to do at this point is to pull forward, for a physician, you can look at his or her infection rate or his or her error rate or this or that. It's very difficult to do that with an advanced practice nurse because the patient is under the physician's identification.
Okay, and are there any movements to change that in the coming years?
I think that as we implement the electronic health record. One of the things, and I'm not going to say that this is the next step, but people have said maybe we could bring the large vendors of the electronic health records together, and most of them have chief nurses, and talk with them about how we could better work to program to be able to pull and evaluate APN and PA practice.
Okay. And then as far as healthcare reform, which you've mentioned, when do you think the APN and PA specialties will start seeing the effects of that?
I think that most organizations are in a process of assessing what healthcare reform is going to mean to them, as well as assessing what's going on, in the elections, in the government, what's going on in the payers and the providers. So I do think we all believe that there will be more patients accessing care. I think everyone knows that there's a physician shortage looming. There have been studies that have come out and said we need to look at alternative models of care, and APNs and PAs, APNs very much can be part of those models of care. So I think it's just going to be a continuously evolving question, initiative, collaborative.
Great. Well, it sounds like you're definitely on the right track. Thanks so much for your time.
All right, absolutely.